Hey, how's everybody doing? We had a question come in about IT band syndrome and how to self-treat your IT band syndrome. So important to note about the IT band, the anatomy. So your IT band is what I've marked on myself here in orange. It has an insertion point here just lower the knee. It's called Gerdy's tubercle. There's fascial attachments into the fibular head as well as the fibularis muscle group that runs all the way down. It comes up and attaches into the glute, your gluteus medius, your gluteus maximus. And ultimately, these are the ones that are really important for directing tension along your IT band. Okay? Years ago, it was called IT band friction syndrome, and the idea was that through flexion extension, the band was moving around and it was irritating the fat pad underneath here, which I've marked in green. Now the newer research shows that this is actually a compression syndrome. So everything is getting really tight and compressed, and it's compressing that pain-sensitive fat tissue underneath, and it can get really inflamed. So the last thing you want to do is get in and directly compress that area, especially initially. If you're thinking about doing some self-treatment, you want to think about treating above and below. And I look at this as this is a whole lateral chain issue. So if we're treating or we're strengthening, we want to look all the way, not just right here. I'm going to walk you through self-release of the glute using a lacrosse ball. So I mentioned before, the glute attaches in with the IT band, and tension or lack of strength through the glute muscles can be a big contributor of why you're getting the pain. So find the bony part here, it's called your greater trochanter, and you're going to move just slightly above it, place the ball there. And I like the ball versus the roller because you can just get into more focal spots. And so find a spot, and it might be a little bit tender. Intensity here when we're doing any type of self-treatment, keep it to a 3 or 4 out of 10, no more. And then what I like to do is, once you've found a point and you've sort of sat down on it, sunk in, just add a little bit of movement. Hip flexion, in and out. Okay, we're going to do about 30 seconds on each spot. And then now, so I'm going to move it just slightly back, tension on it, roll onto my side a little bit more. You can go right down onto your side, and same thing. Just like this. I shouldn't see when you're doing this any like white knuckle, keep the breath, should be fairly relaxed. Again, yeah, I feel something, but it's not putting me through the roof. Okay. And we're going to go further up. You're going to feel the bony part, the top of the iliac crest. So we're going to get a little bit more on the gluteus medius, maybe minimus fibers. Yeah, oh yeah, feel this one here. And same thing, in and out. Add some movement. Okay, next, we're going to start at the TFL, which is right here, and again has an attachment to the IT band. So we're starting away from where the pain is. Hold a point, and again, you're going to add some movement with the leg. In and out. About 30 seconds at each spot. No more than about a 4 out of 10 intensity. So the idea here is that the IT band gets stuck or compressed to the adjacent tissues. Right? As you move down lower, you're working through the vastus lateralis, okay, which is right next to the IT band. And if you move a little bit more towards the center, you're going to get in between the vastus lateralis and your rectus femoris. And this is often an area that gets really sticky. Roll down a little bit more and keep the knee moving. Okay, we're going to get down further. Whew. Yeah, and there's a spot there that I really feel sort of borderline, that 4 out of 10 for me. And you never want to roll directly on the IT band. It's very pain sensitive and you can't change its length. You can hang a Volkswagen off of your IT band. It is very strong. And we're not trying to lengthen it, so we're just trying to free it up and really free the adjacent tissues up more than anything than actually the IT band. So as much as we call it IT band syndrome, it's really, the problem is not your IT band itself. It's the muscles that direct tension on the IT band and the adjacent muscles that get stuck or compressed to it. Okay, so now we're going to try to free up the biceps femoris with the IT and the vastus lateralis. Your vastus lateralis is a pretty big muscle and actually passes below the IT band. And your biceps femoris lives right here. So I like to use a block, or you can use some books to prop up a little bit and get some pressure here. And then I'm going to just roll a little bit on my side. Try to keep the ball on the block. There. And just add a little bit of movement again. Okay. And you can roll back this way. And you do a little bit of this type of rolling as well. Back and forth, lift yourself up a little bit. Okay, so we're not really ever getting directly on this point right here. If you roll directly on this point, you're gonna piss it off, I can guarantee that. Again, about 30 seconds at each point. You can really overdo it. I've had patients come in that have spent 90 minutes while watching Netflix, rolling their glute or their IT band, and they can barely walk the next day, right? Remember, use common sense when you're doing this stuff. Okay, so the last part that we can, think about when we're treating IT band syndrome is just the fibularis group, the lateral muscle group of the lower leg, because it does have fascial attachments to your IT band. So really simply using the block again, get the ball on there, create a little bit of tension, let it sink in, and this time you're going to just move your ankle in plantar flexion, pointing the foot down, in dorsiflexion, and you're going to move that all the way down towards the foot. So this is just part of a treatment plan. It has to include the proper strengthening and mobility exercises, mainly directed for the hip. And it's important to sort of note that running technique can be a big factor in this. If you're overstriding and crossing over, that can be a big risk factor for developing IT band syndrome. All right, I hope this helped. Stay tuned, I'm going to have more for you. If you have any questions, send them my way. Any other videos you want to see, and please share with everyone that you think this could help. Thanks.